So you've just had surgery. I'm going to be discussing just quickly about your post-operative visit and some of the post-operative care for your eye after surgery. The first day after surgery, we will remove the eye patch. That's the first thing that we'll do. Depending on the surgery, but most of the time, the first day the vision may be a bit blurry. For a few reasons, you may still have some ointment in the eye, the pupil still may be dilated, there may be some swelling on the cornea, you may have a gas bubble in the eye. So the first day after surgery, often the vision is slightly blurred, but that should improve as time goes on. It's very common to have some irritation in the eye after the surgery. Typically a feeling of a foreign body sensation, feeling like there's some sand or grit in the eye, particularly when you blink, because often when your lid moves across a surgical site, it may feel like there's a small scratch in the eye. So that is often quite normal. Besides your normal drops that you'll be given for post-operatively, we always recommend adding an additional lubricating drop if necessary, and those can be used as much as required. But we'll tell you exactly which lubricating drops to use if you are struggling with some of those symptoms. It's important that you have fetched your medication or have your script that was given during surgery to ensure that we can explain exactly what drops and tablets to take and when. Most of the time, after most eye surgeries, we give eye drops for about a month period, but when you come in, we'll explain to you exactly which drops to use and how often to use them. After your post-op consultation, it's important to still wear your eye shield. You don't necessarily need to wear an eye pad, which is the white cotton that goes under the shield. For the most part, the plastic eye shield will be given to you to place over the eye to protect it. If your eye is very uncomfortable and you have a lot of scratching, then patching the eye closed can help. So in that case, you're welcome to place a piece of cotton wool or an iPad underneath the shield to keep the eye closed if you're finding that's more comfortable, but it's not necessary. The reason for the eye shield is that some of the wounds, if you push on the eye, may open, and we're wanting to ensure that there's no pressure on any of the incisions. So having a shield reminds you that you've had eye surgery, that if you try push or rub or touch the eye, that it's protected. If you accidentally walk into a door or are sleeping on that eye, it ensures that that eye is protected. We normally recommend that you use your eye shield for at least 1 week, maybe longer depending on the surgery. Although eye surgery is very safe, one of the dreaded complications that we're always concerned about is an infection in the eye, and that infection is called endophthalmitis, which is a very rare condition. But it's important to be aware of the symptoms in the first week after surgery. So if you experience decreased vision, increasing redness, or pain in the eye, please come in straight away. If you are concerned, if you have any concerns, please feel free to contact us, call us, or come into the practice in the early post-operative period. Please don't wait at home for your post-op visit if you have any issues. After the consultation, you'll be giving a post-op date. Please ensure that you note that and diarize to ensure you make your post-op visits. It's really important just to keep track of what's going on that eye. Regarding showering and bathing and cleaning, we normally recommend that for at least a week that you avoid getting water and soap directly in the eye. So we recommend bathing, as it's much easier to keep your head above the water and to wash the face. You can wash your face, but to do it gently, especially around the eye, to not put any pressure, to use a cotton wool with some warm water to gently wash the lids, lashes, and the external surface of the eye, but to avoid direct water contact. So when showering, if you're putting shampoo in the hair, often lots of water runs down the face and into the eye. We suggest avoiding that for the first week at least. And then importantly, regarding exercise and activity, for 10 days, we recommend rest from any activities, Pilates, running, cycling, jogging, any activities for the first week, especially heavy lifting. Also to be aware of lifting heavy things at home, so to avoid those things. Straining, coughing, sneezing, those kind of things, also to try and limit them, although that's often a challenge. So a common question I'm often asked is whether one should wear dark glasses. That is really a personal preference. If you're going to the sunlight and you have a lot of discomfort and photophobia, then by all means wear sunglasses. They can be very helpful, but it's not a must do. If you are comfortable, if your eyes are comfortable when you walk outside and you have no pain or discomfort, it's not essential to wear sunglasses. But all the best with your surgery. I'm sure it's going to go well, and I hope you have a very pleasant experience.